Welcome to today's episode. We are diving into the fascinating world of TCM clinical practice, exploring interesting cases, challenges, and also memorable patient experience. Today, we also invite Dr. Peter Mel, assistant TCM practitioner doctors from the attending physician of the Department of Traditional Chinese Medicine, China Medical University Hospital, here to share some amazing stories with us. 欢迎收听今天的节目，我们将深入探讨中医临床诊疗的世界，了解医师们在诊间遇到一些趣事、挑战和难忘的案例。那我们今天又在特别邀请我们的马培德医师，是我们中国医药大学附设医院中医内科的主治医师。那他具有非常丰富的临床经验，而且有很多特殊的一些趣事跟一些特别案例。那我们在上一集的时候呢，他其实跟我们分享一下，很多人呢进到诊间的时候看到他会吓一大跳，为什么？因为他看到马培的3个字应该是华人面孔，可是一打开看到是一个德国人，对，所以大家就很惊讶，而且问他说你会不会讲中文，甚至还问他说你怎么会用注音符号打字？对，所以这个是非常有趣的一些 case， 所以他上集呢有跟我们做分享。Yeah, well, welcome, Peter Mel. Welcome, come again.
Okay, thank you very much.Yeah,
and also the same way, I think you can give you a brief introduction yourself, and also maybe give us some kind of small brief introduction why you want to become the TCM doctors in Taiwan.
Yeah, so I'm Peter, and originally I'm coming from Germany and being a Western medicine doctor in Germany. So because of my interest through Chinese martial arts,In Germany, I started to learn martial arts, traditional Chinese martial arts as a child when I was about 12 years old. And I studied with a teacher from Singapore at that time. So because of this kind of experience, I got fascinated with not only traditional martial arts, but also with traditional Asian or Chinese culture, and also with Chinese medicine too.So that was also the reason why I came to Taiwan and to learn Chinese medicine actually. So the thing is, I wanted to come here for 2 years to do my master's in Chinese medicine and then go back to Germany to practice. But after I did the master's, I also did the bachelor in Chinese medicine. I got the Chinese medicine license in Taiwan. So we had the purpose to stay here for 2 years, but 2 years became 18 years now. So now I'm also a Taiwanese citizen and practice and live in Taiwan. Yes.
对，马培德医师是台湾人哦，他本来预计在台湾2年，结果呢待了18年了。
是，
哇，
所以我们本来的计划就泡汤了，失败了，2年变18年。
不过很好啊，我觉得因为马培德医师他的医术很棒，而且呢他的中文真的讲得很好。如果您今天我们不讲英文的话，直接用中文讲，搞不好台湾话也可以，你可以讲得很棒。
台湾话我听懂，然后比较不该讲的我都会讲。
这不该讲的我们要试试看吗？不要。So Peter Mel also can speak Taiwanese and he also knows a lot of something interesting in the Taiwanese languages. Yeah, but maybe next time we can have something.
We can have a special podcast on Taiwanese language, maybe.
It could be. We can do that. Okay, yeah. And I think the more important is during the practice, because now you are also our attending the physician in our department of traditional Chinese medicine in our hospital.
Yes.
So I think maybe is there any kind particular interesting or maybe some unforgettable the cases from your clinic, or maybe some kind of surprise or maybe big challenge for you from patient. Can you share some stories with us?
Yes, of course. During the years of practice, actually, we have many cases.
Mm-hmm.
And for me, because I'm actually in the chest medicine, Chinese chest medicine, so mostly most of the diseases of my patients they have to do with the lung. So I have many lung cancer patients who I treat, and of course, most of the patients are maybe older patients, and they have a history of smoking history or some other risk factors they have to get lung cancer. But sometimes you also meet some patients there who are pretty young.
Mm-hmm.
So this is, of course, usually these are very sad cases. Yeah, like I had a pretty young patient who's at the age of 32,
Mm-hmm.
and he was actually a non-smoker. He never smoked in his whole life, but suddenly, because he was coughing and his cough didn't go away,
Uh-huh.
so he went to see a doctor for this, and they did an X-ray in the hospital, and they found out that he has lung cancer.
Oh.
So he was, of course, totally shocked about this, and it's not only lung cancer, but he was already in stage 4 of lung cancer, and this is the final stage, right? So it's very advanced kind of lung cancer. So this patient, okay, he was in his treatment, very optimistic actually, yeah. And he tried everything to do to bring himself even in a good shape.
Mm-hmm.
He tried out all kind of treatment too, like he was under Western medicine treatment, and he also came to see me for the Chinese medicine. So for him, of course, Chinese medicine can, in this case, have good effects too on cancer patients. Yeah, for example, we can lower the side effects, of course, very successfully because of the chemotherapy he received. He had very massive side effects, which we brought under control with Chinese medicine. And of course, Chinese medicine also has the possibility to bring the patient in a very good anti-cancer environment, actually. So he also, besides taking medicine, he also actively participated in, for example, our Tai Chi program we have. We do especially with lung cancer patients to improve their lung functions, to maybe make them feel better, having more energy, and to improve their immune system, of course, right? So he went running, so he's very, very active, right? So yeah, during this time, you built a pretty, I would say, even a close relationship with these patients, and especially with this young patient too, right? So yeah, the sad thing is about this patient, even he was very optimistic, very active, and he had the lung cancer pretty good under control. But there was then the point where suddenly it became out of control. Yeah.
Oh.
So, and you know, these are these things like when you become very optimistic, seeing how positive actually the people cope with this kind of disease, even they're in the final stage. You know, you would never expect that this patient has a lung cancer because he went even running. He was preparing for a marathon. But suddenly, the cancer got out of control, and so he had also a severe cold at that time he received during all of his treatment, and suddenly it went very quick, and he couldn't get out of it, and within a very short time, even passed away.
Oh.
Yeah, so it's a very sad story. Yeah, and when you have patients like this, young patients having this kind of treatment, of course, or this kind of story, it's
very sad.
It's very sad.
Really, really. Because as you know, because Dr. Peter Mayer, give him some treatment with the TCM.
Yes.
And also let him practice the Tai Chi.
Yeah.
Yeah, because Tai Chi, really can practice, can give it some enhanced immune system.
Yes.
And to do some kind of prevention about some of the cancer, attack something. And also the TCM also can reduce some side effect during the patient.
Definitely.
Yeah, to treat some kind of side effect from the chemical therapy or radiotherapies.
Yeah.
So TCM can have a lot of help.
And that's how we actually do the integrative medicine. So, and I think with the Western and Chinese medicine, I think we can provide even better treatment to our patients. And for example, even if they are in a final stage, you keep them stable for a pretty long time with this kind of treatment. I think this works, overall, it works pretty well, of course. But yeah. And the interesting thing is, he was a non-smoker, so...
Yeah.
What do you think? Why?
No, because now it's very difficult to say, okay, even, the patient doesn't have any kind of smoking habit, but, environment could be also have some factors.
Exactly.
Could give you some risk to get this kind of lung cancer.
Yes.
Yeah.
So exactly in his cases, because he was a chef, so he was cooking for about 10 years or something. And so it's obviously that it was because of his occupation that he has.
Okay. Yeah, because during the cooking also have some smoking.
Yes.
Smoking could be also is one of the reason to get this kind of lung cancer.
Yeah, especially in Taiwan, because like many people cook and outside, and you have these kitchens outside or inside, right? And people, so I think this is a pretty high, risk factor maybe, to get.
所以呢，其实中医呢真的可以帮助病人，尤其对于肺癌的病人有很大的帮助，因为马培德医师呢，他是比较算是在胸腔内科这一块，然后对于很多一些所谓的肺癌病人呢，其实他可以用中医来减低他的一些化疗或是放射性治疗的这些所谓的副作用，而且呢可以提高他的生活品质，然后呢甚至在一个比较严重的一些阶段都可以维持一个很好的维持的一个状态，然后最后他还有带领这些肺癌病人去做太极的练习。
是的，
对，
因为太极拳其实对肺癌的患者蛮有帮助，因为我们就是练习他们的呼吸，是，然后加强他的免疫反应，是，然后整个体力也会，每一个人都会觉得很快就体力就上来了，就会觉得好像蛮有活力的，所以整体来讲这种训练的方法帮助非常大。
对，我想其实这是我们中医可以做的，所以在我们学校附设医院呢，我们有所谓的中西整合治疗，也就是病人可以需求的情况之下，那他可以有西医的治疗之外，也可以来用中医来做搭配治疗，可以降低甚至增强他的治疗效果。
是的，所以比如说我们那边也有一个肺癌的一个团队嘛，所以有不同的西医师，然后也有中医的代表，所以我们就是会一起帮病人做治疗，对。
So there's a team.
There's a team, yes.
Lung cancer team. They're integrated with some Western medical doctors and also traditional Chinese medicine doctors.
So we work together, hand in hand, and to give the patient the best treatment, actually.
Yeah. Okay. So I think it's very, very good, the options to let the patient, especially for the lung cancer patient, have the best treatment in our hospital. Yeah. So, of course, I hope, our audience doesn't need to have this kind of team, but if you have some kind of normal situation or, some small problem with the body problem, maybe they also can find you have your treatment, right?
Yeah, of course, definitely. Even I'm there in the pulmonary medicine or chest medicine, but I also have many patients with allergic diseases, for example, or maybe some skin diseases or some other kind of problems where I do not only use Chinese medicinals, but I also use acupuncture too. So in Chinese medicine, actually, we do not separate too much. So most of the doctors still see many different kinds of diseases, right? So even common cold or something, okay, so we also treat too. Yeah.
Okay. 所以其实马培德医师呢，他不是真的只有刚刚说他是在我们附设医院的肺癌团队当中，其实如果有其他的一些问题，比如说像刚刚说过敏啊，或是一些
肠胃的问题、
皮肤问题，对，或是一般的感冒，其实都可以来找我们马培德医师。
当然可以来，
对，那他也可以用针灸，也可以用中药来做一些治疗。对，
没错。
Now how can I find you?
Yeah, so if you would like to find me, just go online and check the homepage of China Medical University and type in 马培德 Chinese medicine, so you will find me.
OK, 所以直接到我们中国医药大学附设医院的网站，然后找马培德医师，直接打入马培德医师，或是到我们的中医部，也可以找到我们马培德医师的挂号的一个方式，然后就可以直接挂号。对
，Yeah. Okay.
Yeah. So thank you very much for coming and also give a very, very, I know it's sad, but really, inspiration, it gives us a lot of the feeling the stories with us.
Yes. Yeah. Okay. Thank you. Thank you very much for having me here.
Thank you for coming. Thank you.